Lauren, a lot of leaders start with beautiful dashboards and they don't necessarily always drive change. How are you helping clients right now move from insight to execution when everyone's stretched so thin?
It's a great question. And it actually is speaks to sort of our evolution as an organization, actually, because when we first started Socially Determined, we were really focused on how do we create the best data set and the best product to help display that information around social risk at a community and an individual level. And we sort of had this idea that, like, okay, if we create this amazing data set with all this rich information, and then we make it really easy to find that information, aggregate it, analyze it, that our customers would just go and use it, right? Like they would go and take that data and pull it into their decision making and their strategy. And some of them did. But what we found is that really they need more. They need us to take that data and actually make recommendations and tell them what to do with it. Like, I think one of the things that we're finding about the social risk space and the intervention space is not only do customers need to understand what the understand the needs of their population, but they also need help understanding what to do. And so, what we've been working on in the last year or so is we're partnering with a number of organizations to pull our data together with claims data, as well as research around interventions, so that we can then go to our customers and say, not only have we provided you insight into the needs of your population, but we can also identify where those needs are driving cost or outcomes that you're trying to influence. And not only can we do that, we can tell you what to do about it. And we can do it in a way that's supported by research. And by the way, let's see if we were right and track it. And so we're building what we're calling sort of our measurement and outcomes framework around that exact approach, which is not just telling organizations where their risk is, but what to do about it and if it works or not.
That definitely gets right to the heart of it, proving that social risk analytics actually do drive value. Notice that speaking of partnerships, you partner with Mathematica and Meta Analytics, and those are
Yeah.
two names that carry a lot of weight when it comes to measurement and actuarial validation.
Yeah. Yeah. And we built this approach really with Meta Analytics and Mathematica. It doesn't have to be with Meta Analytics and Mathematica. What we have sort of found, one of our challenges, right? We don't take in claims data right now, and we are a SaaS organization. We have a lot of expertise on social risk, and I think we are leaders in this space, but we're not consultants. That's not sort of what we deliver. And so, by bringing Medi to the table with their health fabric product, which really allows that they pull in claims at scale and they created dashboards that pull our data in. That was like a really easy button to be able to present that data to our customers. But we have customers that are doing the same thing with their own platforms that are not the Medi platform. And they're still able to sort of get to those same results. One of the things we are bringing to the table that's unique is independent actuarial validation. So we have an actuary that we work with who's looking at that data and brings that expertise as well. And I think that also adds a layer of, and they're outside, they're not us. So it's sort of someone else saying, no, 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 this data really is showing there is a relationship between risk and cost. And here's where it is, and here's where you should focus. So um, I'm sort of talking out of both ways, right? Because we've built this really strong model, but I don't want people to feel like they need to partner with like four different organizations to do this, right? We can work within your existing partnerships to because it's really just how you bring together the data, right? And so we can work within that. But we're learning a ton from what we've built with this organization that we feel like we can bring elsewhere.
I think that's a perfect segue into the next question I have. So, we're in a cost containment cycle where plans are really defending margin right now
Yeah.
rather than funding pilots. How
Yeah.
are you showing that social risk analytics can still protect the bottom line? I kind of answered it a little bit already.
Yeah, no, I mean, but it's a really good question, and was talking to Trenner, my CEO, about this yesterday, which is, we are it's every line of business right now is looking at as having to defend that margin, right? It's not just commercial or government programs. Everyone is. That's just the environment we're in. I think we're at a place where the industry, in the past few years has recognized that social risk and social determinants of health impact health outcomes. And they've made efforts to invest in different intervention programs across the board. Um, and I think we're at a point now where they really need to make sure they're precise about those interventions and that they're pointed at the right people and that they're getting the outcomes that they need. And you can't do that if you can't measure it. And you can't measure it if you don't have sort of a baseline at scale to start with. So we actually feel like we're in a really good place for our data because before it was sort of like, all right, let's try some pilots, let's throw this here and there, see what happens. And now it's like, okay, well, we know this matters. We know it impacts healthcare outcomes. You have to be reducing costs. But let's be really thoughtful and purposeful and precise about how you are allocating those resources. And you can't do that if you don't have data. So it's it's sort of an evolution of where the industry has been and is going. And I think that this financial pressures are actually accelerating that a little bit.
Definitely, we're seeing that too. Can you ground us in that just a little bit?
Yeah.
Is there any specific kind of ROI window or performance metrics that plans are actually seeing these days?
Yeah. So, I'm going to answer your question, but zoom out a little bit. But one of the challenges that I think anyone in this space, and I think, Christina, you probably see this too, is that we know over the long term that social risk has a real impact on healthcare outcomes, right? If you are, if you are housing insecure for years, the stress of that impacts your health. If you are not able to afford healthy food for years, it may not impact you in your 20s, right? Like you can get away with eating cup of noodle in your 20s, but it catches up with you later on. And so I think one of the challenges that organizations that are trying to drive um, like to drive cost reduction through these interventions are challenged with is, well, what are the short term outcomes that we can drive towards, right? Like what can we do with an 18-month timeline, not just not a multi-year timeline around social risk. And so one of the things we are really focused on with this measurement and outcomes work is identifying exactly those things. So maternal health is a big one. And I think you've talked about this with other guests on your show. But it's an episode where if you have the right intervention in place, you can really make a difference. And so we have a customer where we've identified food insecurity and maternal outcomes in a specific age cohort and seeing a real relationship between individuals who are food insecure and their cost and their outcomes and those who are not. And that's without even looking at data about the babies, by the way. That's just looking
Wow.
at moms. So, really, and that's just one example, but where you can we're really trying to isolate on what are those episodes. Diabetes is another one where, it is a chronic condition, but if you are not managing it in the short term, it is going to, in the short term, impact your costs, right? We identified a cohort we did in one of our recent analyses there, we identified within a group of diabetics that the higher risk population was actually spending more on medical costs, but their pharmacy costs were lower. So if you're just looking at costs across the board, they may not seem more expensive, but if you look at where the cost is, they're not spending on pharmacy because they're not compliant, they're not adherent, and that's impacting their medical costs, right? And you'd much rather have people compliant with their regimen, right? Or management of their chronic disease, so they don't end up with medical costs. And so that's another sort of it's not an episode, it's a chronic condition. But if you are not managing it in the short term, you will see a short term cost implications. And so 2 examples, but those are sort of easy ones and where we're starting with, but there's so many, more that we're digging into.
Thank you for providing such rich examples.
Yeah.
I kind of want to just sneak in one more question before I move on to the
Yeah.
next segment here. So, the way I've seen procurement happen is
Mhm.
that they tend to the overall strategy seems to be more about what gap in quality or
Mm.
risk does this particular vendor
Mm,
cover, and not in terms of, you know, we're going to fund by maternal, we're going to apportion this much
got
to
it.
maternal health or to
Maternal health.
homelessness or whatever else
Got it.
the other sector.
That's actually a really good question. Yeah, it's actually something we struggled with in the sales process. And we've had to guide our buyers through that understanding of, okay, you have this gap in care that you're trying to close. Let's back up because you can't truly close a gap in care until you understand what's driving that gap in care. And that's one of the things that we can help you do. And so often we're sort of our hook in the door is the way that they traditionally buy. And then we have to sort of teach them and help them understand how this data can be used in so many different use cases. And so very often, right, our sales team will meet with, and sometimes it's actually the growth team, right? They're doing an RFP and they want to show that they're making these investments. And that's our way in the door. And then we're like, hey, by the way, like you can do all of these things. And so that's why, we have a really good customer success team who's very good at sort of saying, okay, like here's just the one problem you're solving, but um, here are all the other things you're not thinking about. And we partner really closely with those leaders. We're very lucky that most of our buyers are on the more senior side of things because this is really a strategic investment. Um, and we really do partner with them to think a little bit differently about how they are delivering solutions. It's a challenge, but I think it's very cool when I look at our sort of customer history. Once we are sort of working with an organization, they stay with us because they sort of see it's a longer term transformation that they're working with them on. So it's different than how they usually think about it. So that's a hard sort of first step for us. But once we get over that hump, there's a lot we can do together.
Right now, every deck says AI powered or real time, but when
Yeah.
you look at those 12 to 24 months out, what will actually separate the analytics that get funded from the ones that don't?
So our data asset is measuring risk and giving you sort of a likelihood that someone will struggle with food insecurity, data, housing instability, et cetera. But the power, and I think where AI is going to be a real differentiator, is where that data asset is combined with outcomes in a sort of longitudinal look, right? Where we have a learning model where you're actually looking at, you know, you did an intervention based on this data set. Did it work? Who did it work for? And learning from that. And so we've begun building some of that. So we've partnered with one organization to look at churn, right? So we have years of history because we get a monthly roster from this organization. And so we're able to see actually over time in this particular case, we're looking at movement from commercial to Medicaid. So, how many people aged into the same, sorry, commercial to Medicare, aged into their Medicare Advantage plan and who dropped off, and looking over time at can we predict that based on social risk data, and we can. And so we're starting to build that model, and on a monthly basis we'll be providing information to that Medicare team around, okay, these are the people who are approaching 65 and are at risk of not staying on the plan. Maybe you should be thinking about why they aren't and what you can do to keep them. That's just one small example. It's not really social risk intervention actually, but it's the reason people drop off is related to their social needs, right? Um, and then another example we're looking at is around work requirements and Medicaid redetermination. So whether or not someone is likely to be able to navigate that process, which is becoming more and more important right now. With these new work requirements, it was always a challenge, right? You still have to redetermine, and that's hard, and people drop off every year for that reason. But with work requirements, we've added an additional layer of complexity. And so we have a model that is sort of measuring someone's likelihood that they will struggle with that process. And we're working with some of our customers to get feedback from them on what intervention was taken? Did you do outreach? Who did you reach that person? What did you do? And were they able to retain their coverage? And now we're building learning models based on that. So I think it requires rich data, it requires frequent data, and it requires time. And I think that's building that sort of feedback loop and being really clear about what you're measuring and why is going to be really important.
Do you think that your background has kind of influenced that approach? So I see you've worked in policy, analytics, operations.
Yeah.
Right now, policy is lagging really while operations still have to deliver. And so do you think that that perspective kind of helps you keep organizations like your clients moving when policy slows down?
Yeah, I think we've had to be that way from the very beginning. I think when we started this organization, that we thought that there was going to be sort of a more of a policy mandate, a faster moving mandate around this kind of data. We thought that social risk would be part of risk adjustment and this data was going to be a huge part of that. And that really never came to be. It was a lot slower. It was more focused on the policy was really more focused on screening versus, larger scale measurement. And so we've had to over the last 7, 8 years be focused on making sure that organizations are doing this because there is a financial outcome, because there are results, not because they're being told to do it. And I think that's, we the term health equity, right, has sort of like fallen out of favor for better or worse. And so we sort of say we were never a health equity company. We fundamentally believe that if you address the social needs of a population, that you will get better health outcomes and that better health outcomes are return there's a return on investment in that, right? If you are managing a diabetic's chronic condition and you're doing it well, they will be less expensive in the long term, right? And so we've had to build our company around that. So this isn't actually a change for us. We, retrospectively, it would have been nice if there were mandates that everyone had to do that. It would have been a lot easier for us. But we've had to operate in that environment from the beginning anyway. And actually, our challenge is helping educate people that, like, no, 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 we're not a health equity company. We're a an outcomes company. We're driving healthcare outcomes. So um, yeah, it's a shame, but, it doesn't really change how we do business.
That makes complete sense. Yeah, when equity is measured like margin, people start managing that. Have you seen that shift take hold?
Yeah, yeah. I think we have, for the first in the beginning of this company, having to convince people that this data was important and it mattered. Now we don't have to have that conversation anymore. Like, they get it. They get that everybody needs to have insight into social risk. Now the conversation is, "Well, what do we do?" Moving beyond the, like, convincing people that it matters to what do you do has been has allowed us to, like, move faster to results and to actually partner with organizations that are planning on doing something. In the beginning, organizations would, like, buy the data and be like, all right, we're ready to go, and then they wouldn't make the investment to actually act on the data, right? And now we're not seeing that problem. Now we have plans coming to us and saying, hey, we're building this program, we're already doing something, we think your data will make it better and more precise. So they've already gotten to the point of acting versus us having to sort of say, no, you need to act. And that's been really exciting.
Thank you so much for your
Yeah.
leadership and for your clarity today.